thank everyone for participating in the second Global Fund for Forgotten People Zoom conference. I would say we were just talking about compliments, and I think this is a great indication of the feeling we have both for the Order and for our dear Grand Hospitaller. I'm so grateful to His Excellency Dominique de la Rochefoucauld for agreeing to spend this time with us, and I am sure it's going to be a very interesting conversation. I realize that the Global Fund has quite a good overview of what's happening amongst the associations and other entities of the Order, the relief organizations and the ambassadors. But it's obvious that the person who has a far better view than any of us is the Grand Hospitaller and his office. So I thought this would be a great opportunity for us to all share this time and to really get a deeper understanding of what the Order is doing in the field now as it relates to COVID-19, and also have a chance to share what might be happening in your organizations. So without any further ado, and I will now invite Dominique to give us, His Excellency, to give us an overview of what is happening in the field. Thank you so much.
Thank you very much, Lisa. It's a great joy for me, and I want to, let's say, extend my greeting to all of you who are on the phone or on the Zoom system. You imagine if this had happened about 20 years ago, we would be with Nokia 3310, 20 minutes or 2 hours speech per month, and 20 SMS. So I think we wouldn't have been able to get together as we are today. Now, it's not that I regret there's a pandemic today, pandemia, but unfortunately, well, the world is being what it is. We have to be a bit ready, let's say, to be on the front line time to time to help those who are in need. I won't say it's a tradition of the Order, but the Order has already gone through some quite difficult moments of disasters. I won't say about war disasters, but already when you hear when there were all these plagues coming over in Europe, coming from the east towards the west, or from the west to the east. The plague of Marseille, for example, the plague in Italy, the plague coming from Syria, the plague coming from India, all this 2 or 3 centuries ago. Well, all the homes and the houses of the Order were, of course, full of people suffering terribly. And it was also the same thing when there were these huge earthquakes, not only lately in Italy, but when you remind Messina, where we think that maybe 90,000 people died. The Order went down there, and even at the first earthquake of Messina in the late 18th century, from the island of Malta, they came about to rescue the city already. So we do have this background of service, and I must say, the first thing I want to say is a great thank you and a reconnaissance for all those who are on the front line. Volunteers, staff, members of the Order, and for all the initiatives which are taken. This is maybe the big change from the other time. There have never been so many involved with so many suffer. Through our homes, through our hospitals, through our social services, our sanitary services. Of course, there are some associations who are more involved than others. But the care of the neighbor is, I think, on the front line for everybody. But my gratitude is really for all those who are on the front line. We've got thousands of men and women, often young, who are there coping with sick people who are really sick. And they are putting at danger their life. Nobody was really ready for this pandemia. And I think that if we had had some more information coming late 2019, one might have been a bit more prepared. Unfortunately, we're getting prepared now. And now it's already a bit late. So unfortunately, thousands of people are dying. Thousands of people are suffering. And I must say, being in the lockdown, when are we going to get out of it, and how are we going to get out of it? So, as I was saying, there are some countries which have been quite extraordinary, and that's where the order has also been involved, because where there's a high activity, social activity, sanitary and medical activity, we've all been taken in the national schemes of prevention, of care, of rescuing people. So our teams, whether they're vans, whether they're trucks, with their mobile clinics, working in the hospitals, are all in the loop. But not forgetting all those for who we are already devoted. Children in homes, mental and sick people, elder people, and there are thousands too. And this is just staying in Europe. If I have to extend to Africa and to other countries, in Asia, it's the same thing. So we have had to face this situation. And I must say, I was very, very well surprised to see how professional everybody has been. I've never seen so many reports. We are very lucky to have committed people who keep us updated in what we're doing. We get weekly reports, either from ambassadors, by associations, developing their activity, sustaining more and more duties, and this regularly. And I've asked that this list should be put at disposal for all those through the network of the order. So not only will show what we're doing, we're not satisfied just by showing, but it might also give ideas and promote initiatives. I think this is the main thing. Using this possibility that we have, the skills that we have, the commitment which is observed here and there to try and develop even more. What's amazing, and I've been, quite, let's say, involved in the idea so that everybody can share his experience, and to try and do transfer operations, to share know-how and things like that. What I'm amazed is that in this pandemic, in this crisis, we're doing exactly the same thing, but we're doing also with other entities. Okay, we are a Catholic global institution, but we're working with others. And of course, we bring our way of doing it, this holistic way of doing it, looking after the person in whole, and not only of his scars, physical scars. But what's quite amazing is to see how some countries with us are working together. I've listed more or less the 6 or 7 countries. It can be Albania, who is sending 60 medics over to Italy, in Milano, in the resort that we're putting up with the civil protections. It can be Hungary, who through the government is supporting our activities, other activities in South Africa, near Durban. Father Gerard, I thought that you were also on the line. It's also Germany, who has offered 63 beds for patients coming from Italy through Medcare, so that the order is involved in the possibility to be using 4 sanitary planes to move people if it's necessary. So you've got all these organizations who are already of the order, who have been able to get involved, asked by national organizations or by other organizations to face this situation. Situation which is a hard situation, difficult situation. A lot of people are lonely in homes, and they have been also a bit forgotten. They haven't been tested. Some have already died, very lonely, because families can't visit them anymore. So I think that we have to share also through our prayers and thoughts for all these people. And I would say that even if it's been a very rough year for us, because we were all preparing a fantastic 2020 with events. For example, the international pilgrimage to Holy Land, which has had to be postponed to next year. We had already tried to, we were all ready to come to Lourdes, as usual, for the 62nd pilgrimage, international pilgrimage, which is a fantastic gathering. On that point, I just want to tell you that I'll be sending you'll be surely receiving by your presidents or hospitalers or the charge of the organizations of the pilgrimage, a program which has been set up by the sanctuaries for the 2nd of May, where in the morning there'll be 4 masses in 4 different languages, and in the afternoon a rosary, all this dedicated to the intentions of the order. So this is something which has been set up with the sanctuaries. It's a bit just new because I think the letter was sent out yesterday. So don't hesitate to ask those who could have got that letter to inform you about that. So coming back to what I was just saying, it's a challenge. It's a fantastic challenge. We know our professionals are good. What we would like to is that all our members, in their capacity, and it's not to do extraordinary things, it's just to have the care for those who are just next door, who are maybe in a tougher situation. We're all confined, more or less. It's easier when you have a house and a garden. It's much more complicated when you're 4 or 5 in 20 square meters. So, and facing north, of course, no sun. And not in a small courtyard, that's even worse. So I think we have to find a way to stay in touch with all those who also are having a tough time, maybe harder than ours, because we find ourselves to be busy, and that helps us to go through it. But it allows us to continue to do what we want to do, and to do it in this typical way of the order, which is our genuine way of the order. May I just remind, whatever you do to the least of mine, you do it to me. So I think this I think could be the spur for us to go forward, even if it's not so easy. Have a good thought, and let's say, get in touch with those who are really suffering. I think I've done a very fast review of what is being done. I'm not speaking especially about a country or another country. Those who are very involved know they're very involved. Those who are a bit less, well, they're a bit less, but if they could do a bit more, that would be perfect. And I think that after all this, it's going to be an extraordinary moment. It's going to be an extraordinary moment because we're going to be able to share all this, and maybe then start some, let's say, maybe other tracks, a new path, maybe a larger path, I would say, to get to work together. Because this is really, really one of the key elements for me, is having seen so many organizations of the order working together, seeing so many of our members in charge of duties, ambassador level, association level, working levels, Ombro level, or any works of the order, everybody in his responsibility have been able to work together. And it's been very exciting. I must say, very exciting to be with them. There we are.
Excellent.
To make it short.
Thank you for that gallop across the globe. And there's a couple of areas that I think we can dig into. The one that you just hit on last is, I think, the point that one has to be on the field in order to respond. In other words, if you don't have a work in place, it can be very difficult to mobilize when there's a demand locally. And this is a very rare situation where most of us are facing the same problem locally. And I think it's I'd love for you to talk a little bit about maybe that point, and whether or not we can somehow mobilize those organizations that have not yet responded.
Well, I think it's very difficult to give lessons, but what I would say is that locally, there's always something being on. There's always some activity on. So the first thing I would say, as a former first aid, being in first aid services, first protect yourself to be useful. That is, you just don't come with your goodwill, you come with a bit more, you come with a few ideas, and you come, I would say, equipped in your heart and your hands to do something. I think it's joining others who are already on the field is fantastic. Putting up something where there's nothing is also, and it doesn't need to be something important. I was amazed how our friends in Spain, who have several centers for homeless, for example, in Madrid, Sevilla, and other places, well, as they had to close down, well, they started preparing parcels of food for meals, parcels, but not just 10. It was 100, 200, 300, 400. And then it started extending to other cities. And lately, I've just been aware and told that in Barcelona, a member of the Order who owns a 300-bedroom hotel, being closed because the reasons we know why he is closed, has opened his hotel for hospitality activities, that is, as a medical center. So it's fantastic to hear such a thing. We wouldn't have had this situation. Never I would have heard that. Never. But it's done. So everybody in his way can do it. You've got a good van, you've got something where you can do the transport, you can transport things, you can goods and things like that. There's so many ways of doing it. There's so many ways of doing it. But I think it's important to do it because you were there when this happened. And the worst thing would be, where were you when this happened? And that you weren't there.
There's no question that for those of us who live in countries where the Order is less known, I think this provides a great opportunity to begin a field of action that is associated with those values that you talk about. And that example was, an amazing one, that one has to use the resources at hand. I also think your emphasis on professionalism, as well as working from the heart, is something that is so specific to our work as members of the Order. You also, now I'm going to go sort of to the other side of some of the points you made, and I think it's an interesting concept that often we don't reflect on in our own lives as we try to respond to the pandemic, is this idea that social distancing is a privilege. You know, as much as it has created a hardship in our lives and has required tremendous change in the way we operate and work, we also, as we even look around these homes that we've been invited into today to participate in this conference, we all have the benefit of silence and distance and space and comfort. And you point out rightly that, with some families in the first world living in very, very small quarters, or even more dramatically in the developing world with no opportunity to social distance, nor perhaps even running water to wash hands or do those take those basic steps. Can you speak a little to what you understand is happening in the order and beyond in that regard?
Well, that's the question. Where are we? Are we also in the slums? I see Wyam Park just in front of me. So Wyam, I know where he works. I know where the soup kitchen is. And I've met the people who are looked after. And I think that's where we should be. That's where we should be. And I know that the French Association is very involved in what's in Africa, running several hospitals. You must think of the situation, how the situation when there was the Ebola crisis. We're coming back to the same sort of thing. That is, you have a less knowledgement of what to do and less capacity to defend yourself. Washing hands where there's no clean water. That's very difficult. Living in crowds. And in a slum, you live in a crowd. I saw that Teresa is following us from Sao Paulo. When you go into the favelas, there's no distanciation of people. People live just next to each other, but really close. So there's going to be a very difficult situation. I would say that I hope sincerely that major companies who are on the track to find medication and or to find a vaccine as soon as possible will not be bargaining too much, as some countries are today, by overpricing some services to deliver medical equipment. This is a scandal. I can really say it's a scandal that some countries are taking a huge advantage for different reasons to serve humanity. Now, this is not acceptable. And you see what's terrible about a situation like this today. Of course, we had all our agendas, we had all our meetings and so on and so on, but we had different conferences that we had already organized to see how we can cope and look after people. We had the Caritas Professional Association meeting coming in a few weeks. We were putting up here in Rome the Global Compact on Education with the Holy See, as well as Religions in Action. These are titles. But this was all on our agenda. Now, all this is a bit moved around because they're postponed. But we're just as busy because now we have to face this new situation. This new situation, which is, of course, I take the example of Africa, but India, the same thing, Middle East. How do you want Israel to cope with the corona if they don't help Palestine? They're all mixed together, even if there's the wall. Patients in Israel, who are Palestine, don't have the same medical coverage. I'm sorry, it's not political. But what I'm saying is that if we don't look after everybody, it's going to be very difficult to stop this. And this is also in our developed countries. If we don't look after the poor, I was reading that in the States, a number of Black are dying in percentage twice higher than other groups of population. Is it medical care? I don't know. Is it, let's say, a perception, which is different? Is it a less possibility to defend oneself by immunity? I don't know. But we have to cope with everybody. And I think this is where I come back to what I was saying just before. Look after your neighbor. Look after, go down where it's difficult. I just got a report today, and maybe they can talk about it, coming from Lithuania. They're going to put up a call center in 42 cities of the country. A call center for those who are alone, for those who are aside. I think this is a huge moment where we can really get involved. Far from other issues, economical issues, political issues, just to get involved like we should. And so I think this is what we have to grab, and grab it strongly, really strongly.
Thank you, Excellency. I believe that Philippa Leslie has a question.
Good evening and afternoon and morning, everybody, and lovely to see those. I'm sorry you can't see me, but maybe it's okay. My question, in the light of this crisis, mental health has become a crucial concern. And in the Order's projects worldwide, do you foresee a permanent inclusion of psychological support and hotline networks for those we care for? And I ask that because in the first world, that is manageable, as you've referred. But what about developing nations?
Well, I think it's going to be a huge concern for everybody, because I think the experience of living in this situation, confined for some, difficult. We can see that aggressivity has gone up in some cases. For those who have been hurt in their heart by losing members of their family, for those who have been struggling as professionals or volunteers, but professional volunteers, looking after people, dying, and so many, there will be an impact. Now, how we will be concerned? I think there will be different levels of concern. Psychological, of course. I remember in France when we had this terrorist attack at the Bataclan. We had 49 first aid helpers who, for the first time in their life, faced 134 killed in one evening in a nightclub. Of course, after it had an effect, not at the beginning, but later on, it had an effect. And we see that also here in Italy, 2-3 years ago, when we had all these earthquakes. And I remember it was 2 or 3 days before Christmas. I was in Rome, and I went up with a car to Montereal, which is an hour and a half driving from Rome, up in the mountains, And there I was with about 100 people in a tent, in a foot snow, deep snow, cold, in the mountains. They could all see their village just above them, that they had to leave because of gas leaks, no more electricity, homes and houses which had been a bit rocked, and so on. And so, of course, these people had to have a lot of help, a lot of support. So there will be. And I think that our teams who are already on that field are going to have to develop a primary service. And not only for those who we're looking after, but also those who will be having done the job. They're going to have a support. But I think in some cases it'll come naturally. I'm not sure that we have to reinvent the wheel. First, you can't just bounce into a service like that. You have to have some training. You have to be coached. But I think that just being present next to somebody who is today suffering of what one can imagine, of loneliness, the shock, sadness. And this is psychological. But there's all those who are going to lose their jobs. And those who are not going to be able to answer to different requirements and to the management of their lives on economical issues, but also on social issues. So I think this is going to, well, it's going to be a high concern. And that's why I think that coming out of this lockdown is going to be a slow process. It's going to be a slow process.
Thank you. I would also add, when the Grand Hospitaller and I were speaking before the call, one of the points he made was that, to a large extent, that Order of Malta is understood for the sort of sensitivity and psychological care that we do give to those that we're serving, and to an extent, this work specifically on the psychological end is is so natural an evolution. Luca, I know you're on the call, and I know that the Italians have now established a field of action specifically related to this. So perhaps there'd be an opportunity during the course of our discussion for you to give us a bit of an update on that.
Yes, just you can ask whatever you want. I mean, I have no problem. I'm here, so ready to answer to any question.
Thank you. Maybe you could just tell us what is happening with your project as it relates to the psychological support of the health caregivers.
Well, it has been very important in these very days to give psychological help to people, and thanks, we were already prepared to this. As has been mentioned before, it is important that the works in each country is trained and prepared to give response. And luckily enough, at CISM level, we were quite prepared in giving such a response with psychological help, and also at the delegation level, because some of the delegation, like for example in Naples, are dispensing this kind of service. Because at Lampedusa, I remember that the CISM is pretty much involved with the refugees which are arriving by sea in Lampedusa, and we set up a few years ago a service just to stay behind our nurses and our doctors. And in CISM, we have been skilled and prepared for 3 or 4 years, and this has turned out to be very helpful in these very days, because we have been able to, let's say, use this kind of abilities and skills throughout the countries, because you can imagine what is for a nurse or a doctor which is involved maybe for 8 hours in a shift, without the possibility of getting out of the rooms where they are with patients which are infective patients, and they see many of these patients dying. They have to deal with the fact that they have to report to families that these relatives of them has died. Those people cannot stay with the one who left them, and therefore there is a lot of suffering around, and it has been very, very important, the skills that CISM has been able to develop. So we have been able to respond very quickly throughout the countries to such a problem.
Thank you very much.
Lisa, I just want to pick up Luca. Grazie tante.
Okay, my excellency.
I think Luca just pressed on the good button. Imagine the situation. You all know that in the Order we run hospitals, homes, youth centers for elder people, homes for elder people, for disabled children, for autistic children. We care for millions of people. Now, when this pandemic came over, we were already looking after all these people. Was coming up this new situation. The situation before, okay, you had patients, you had residents, the families could come, you could have some time off. It was easy going, even if it was in a difficult situation, because you do have dramas in normal time. And then with this pandemic, COVID-19 coming up, suddenly, all the situation that we knew before of care has changed totally. First, you have to look after your patients and your residents, and to be sure that they are going to be well kept. Second, you have to look after their families, because their families cannot come and see them. Then you have to look after the employees, nurses, but even administrative agents, the volunteers coming for the usual visits and all that. And then there's a cut down completely, because then you have to put up to face new state regulations, which are shutdowns, transport, the scary situation in the buses, in the trains. And you have to go through processes where you're checked, clean your hands, put a mask, put even goggles, put a special protective clothing, and so on. And in difficult situations, you have to keep on your work. And when you're a surgeon working in our hospitals, you know that you have to postpone some of the surgery. Why? Because you're just booked up with all these patients coming with this pandemia. So we're in a very, very stressful situation. And as the Order has always had this tradition to look after the person fully in a very holistic way, of course it's even more concern. Because you're coping not only with the patients and your employees, but you're also coping with their families. And for employees, you're coping for their children in some way too. You know, so it is very stressful. And I think that our concern is to support all these people, not only by thinking, by helping them, but also by in our prayers. And we must really help them, because even if we're very professional, and we are very professional, and being very professional, we are in the national schemes. And we are asked to continue to do what we're doing. We have to support them. We really have to support them. It's going to be very difficult after.
Thank you. I know Baronius has now a question for you, Excellency. And please, others, if you have a question, either ask via chat or just feel free to make it known that you'd like to speak.
Sorry to say, but I didn't want to ask anything. We just, of course, if I may, some additional information regarding this 3-on-3-on-3 project. I think that was the outcome of your last conference, or the first Zoom conference, and our ambassador came back to us and tell the story about the psychological aspect of the problem. And something in the bottom of our heart already started working, but then we got very good input to do something in this very special field. Even if we are challenging on this a certain problem as a we don't have so many professional psychologists, but at the same time we understand the problem and the need for that and how lonely people are. And as you know, in Lithuania we cope with 2,600 elderly to whom we should stop serving in a way, or at least we should reduce our activities. And that's why we initiate this idea, and I think it's very simple, just to call each person, to ask everyone, not only the 42 places where we are present, our volunteer or every youth, but also ask everyone within the country to call 3 friends to talk to 3 minutes about very good things, not about COVID or other diseases like that, and ask them on the resume to call other 3 long time forgotten people. And we think it could add up some value to what we are doing. And if I may just short 2 other things would like to point out, as we in Lithuania do, of course, many different activities, but we try to do our best, as our Italian colleagues told. They are training the civil defense people, and we pretty well working on the fundraising. That's why I initiate a special project with the biggest donation portal in Lithuania, and also Vilnius municipality, to raise up money for the needs of for medical supplies. And we quite successfully operating with some other NGOs in Lithuania, and raise up until today more than 200,000 euros. And we share all the necessary stuff to them. But what is also very important and what it's necessary to mention, I think we also facing, especially in countries like Lithuania, post-Soviet countries, facing problem between the government, state government, and the society. I think the very first time ever since 30 years when the government turned to 4 major players in the market, Caritas, Red Cross, Food Bank, and Maltesers, and ask our expertise on they established a consequent reduction fund, and they asked to be involved in planning the problems, what will happen. And that's, again, we are coming back to psychological problems, not only the medical supply needs or food or simple like that. Thank you.
Thank you very much, Rodius, for having done this presentation. I know I regret slightly not coming back to Lithuania, but I hope coming back soon to see how much progress you have done, because every time I came, there was always progress. I just want to add on one thing on this project of picked up a week ago, or let's say a bit more. So everybody can pick up an idea like that and set it up in a few days. We all have already this tradition to phone people, to keep in touch with them, is all our guests who come to Lourdes. We do it quite naturally. So I would say that every association has already this let's say this facility or this habit to call the guests who came to Lourdes before, after, keep the link, and so on. So we just have to extend it to others. Okay, we maybe less know them, but I think we know how to do it, and we know how to keep up a nice conversation. Let's say from the dreary days.
Good morning. If I may introduce myself to this august body, I'm John Christian, and I'm the board president of the Order of Malta Clinic of Northern California in Oakland. And Your Excellency, you talked about the use of the telephone, and that's actually a natural segue to the reinvention of the medical clinic that we've operated for 11 years. We've had to temporarily suspend taking in patient visits due to the coronavirus because of the lack of testing, and also because many of our volunteer physicians and nurses are of a vulnerable age. However, that has prompted our board to reimagine the clinic in its future by adopting telemedicine in a big way. The clinic board is meeting weekly, and we are now committing the resources to provide our volunteer physicians with laptops. We are working with an outside provider, Carryout, to convert our paper records to electronic records. Prescription slips will become a thing of the past. We will simply transmit electronically to the pharmacies the prescriptions for our patients. The local regulations have been relaxed somewhat, such that we can use telemedicine even for the initial visit for some patients for limited diagnoses. And all of our physicians who are embracing telemedicine will be receiving training on how to treat more patients in the same amount of time and be able to track their progress using technology. This is something that we had been considering doing on a limited scale for the last couple of years, but now the coronavirus has given us the pause, if you will, to take a leap forward using technology and preserving a safe environment for both our volunteers and our patients. so that we may continue to serve the needs of the sick and the poor and the forgotten people who are in our community. And certainly with the economic impact of all of this, I think the relevance of our little clinic on 21st Street will become even more relevant in the months and years ahead. So I just wanted to say we are moving forward with all due deliberate speed to embrace telemedicine as a way to respond to the needs of the community. So thank you.
Well, John, thank you very much for to witness of what you've been doing for so many years, and I think now it's become something very special in the area of San Francisco. What you were saying about telemedicine, I think this is going to be maybe one of the consequences of this pandemic. I think, well, what I see here in Europe, telemedicine was looked a bit far away, I would say, and professionals, or some professionals, at least state professionals, were not too eager to go forward. But with this pandemic and people having to stay at home, and the fact that in this country, here in France, we have 90,000 family doctors, and they cope with the great majority of what is needed by a patient. The state has allowed telemedicine, which is fully taken in charge by the national security system. So it doesn't cost a penny for a French person to go through telemedicine. So I think this is going to allow people to have a higher accessibility to medical care. So I think this might be an issue. Of course, there'll be regulations. Of course, one will have to be careful. There's no abuse in the system. But this might be one of the key points coming out of this pandemic, is setting up telemedicine as a regular medicine care system.
Go ahead, John.
Oh, I didn't unmute. I was just going to say absolutely. We don't see it as taking over the traditional practice of medicine.
Oh, no.
But it will be a greater and greater complement to the traditional delivery methods of healthcare.
Thank you. I know that Teresa Samaya has a comment.
Thank you very much to our grand hospitaler, because I know that he works with heart, knowing, getting close to people and knowing what they do, and that's the best. Very good for us, good, and give us enthusiasm. And Lisa, I know you, and you too has a big heart. Thank you.
We're blushing.
Thank you very much.
Thank you, Teresa. Thank you, Teresa.
I know that Elena in Spain also has probably a program that is complementary with what Baronius was speaking about earlier, and I was wondering if you would like to say a word on that from Spain.
Yes, so thank you, Lisa. Thank you. I think, well, yes, I've picked up a lot of interesting ideas with the things you were saying and the Grand Hospital too. Thank you for putting up this conference. It's been very enlightening, especially the after pandemia part, where we all will have to do our best to get things back in order, and it won't be easy, because all the psychological part Luca was talking about is really interesting, and especially the economical consequences. I think we have tried to really recover quickly and try to change our way of doing things in order to envisage the new challenges that this pandemic brought to us, and we have discovered, among other things, the huge generosity in donations, in volunteers, in everybody is really putting all the effort to help others. the phone calls that the Grand Hospital was talking about to our older people or disabled people. They have been constantly, as we can't hug them, and which is we can't even see them. It has been really crucial for us. And what I think we have to be prepared for the future, because this is going to be very, very, very long. And at this point, that I was saying, everybody is ready to help and to do things, but it will be a huge time to recover, and whatever ideas can be poured on that, I would really appreciate.
Thank you very much. Does anyone else have a question that they would like to pose, or a comment that they would like to make? Please just indicate. Well, then I'll ask our Grand Hospitaller to perhaps just give us some closing comment, and then I'll have just a couple of housekeeping and a couple of announcements after he's finished.
Well, I want to thank you very much, Lisa, and all your team for organizing this. We were saying a few minutes ago, it would be nice to phone to everybody. Well, this is an opportunity to see much of you that I would have liked to have seen already in Vienna or in some other event. You must know that for us at the Grand Magistry, and I'm sure that Wilfred and Albrecht even more, are very concerned, because all these events and conference that we organize every year is to go forward all together. To share our experiences, to get a better acknowledgement for all of us of what the order is, what the order wants to achieve. And so when you have to cancel so many events like this year, the list is so long, coming from the Hospitaller Conference of Vienna, the Forum of the Communications, which was in Rome, then, of course, the international pilgrimage to Lourdes. Coming up already, we know that the international pilgrimage to Holy Land is postponed. But then comes also the question of the international summer camp in Italy. This we'll have an answer in a few days. But already we know that the youth camp of Asia Pacific in Brisbane, Australia, is postponed. We have our National Association pilgrimages or Grand Priory pilgrimages. For example, in Italy, will Assisi, the event of Assisi, which is a fantastic moment on the first Sunday, which is really an Order of Malta event, gathering hundreds and hundreds of members and volunteers on the first Sunday of September. Will that occur? Will Loreto, which is the pilgrimage for children in Italy, there are 1,500 people and masses of children. So all these events, all the events that the Order organizes by their meetings on the diplomatic field, on the hospitaller field, the visits that we had to do to Germany, to Poland for the 100th anniversary, for example, of their associations, but also Ivory Coast, Portugal, Argentina, Croatia, Hungary. So we just add more and more things that were prepared, which are part of the living of the order. And it also helps us to develop how we want to get to do things, how we want to succeed in doing them by joining other conferences, centers, these two major events with the Holy See of conferences on global impact in education, religions in action, and so on. All these events are organized for the good of the order and for its members. So for us this year, it's a terrible year because we programmed something. We're just as busy because we're doing something else. So I think that's the positive side. So one can be sad to see all these events not happening or occurred. Some are regular, some are new. We get into them, and I see all our teams that we have are most excited to organize them. And we see that we have to prepare ourselves for something else. And I think it's this fantastic atmosphere that we have to get hands-on and to go forward and to try and tackle it, tackle this pandemic, which is something that we have a lot forgotten. But may I just recall, we had 2 terrible flus in the past 50 years. In 1957, it was the flu of Hong Kong. Millions of people were killed. In France, 20,000 people were killed. It wasn't Hong Kong. Hong Kong was in 69. That was 50 years ago. 69, 30,000 people died. Over 1.5 million people died in the world. We forget them, and we don't get a lesson. We don't prepare ourselves to have a lesson. And so we're not prepared. And this is with the SARS, with the MERS, which are 2 also corona flus. We didn't take the lesson. And so that's a bit sad. So take the good side of it, that we must go forward, keep our banner up, and I think supported also by being a Christian organization, by being a Catholic organization. Pray for those who help, pray for those who suffer. And I think that's how we'll get through it, and we'll be stronger shortly after.
Thank you very much, Excellency.